Bismillahirrahmanirrahim. Today I am going to discuss Parkinson disease and its relation with the basal ganglia injury. Parkinson disease, it is also written in short as PD. It is a neurodegenerative disease that affects predominantly the dopamine-producing dopaminergic neurons and in a specific area of the brain called substantia nigra. And substantia nigra is a midbrain structure that supplies dopamine to the basal ganglia that affect both the motor system and non-motor system. The Center for Disease Control and Prevention CDC rated complication from Parkinson disease as the 14th cause of death in the US. Basal ganglia injury. Basal ganglia injury may occur any condition that can cause brain injury can damage the basal ganglia. Such conditions include carbon monoxide poisoning, drug overdose, head injury, infection, liver disease, metabolic problem, multiple sclerosis, poisoning with copper, manganese or other heavy metals, stroke, and trauma. A common cause of symptom of basal ganglia dysfunction is chronic use of medicines used to treat schizophrenia. Dystonia means muscle tone problem. Huntington disease, nerve cell in certain part of the brain washed away or degenerated. In Huntington disease, nerve cells are destroyed. Multiple sclerosis, which is atrophy, widespread neuron system disorder. In Parkinson disease by itself, progressive supranuclear palsy, movement disorder from damage to certain nerve cell in the brain. Wilson disease disorder causing too much copper in the body tissue. Time of onset of Parkinson disease. Parkinson disease most often develop after age 50. It is one of the most common nervous system problem in older adults. The disease tends to affect men more than women, although women also develop the disease. Parkinson disease sometimes runs in families. The disease can occur in younger adults. Parkinson disease is rare in children. Causes and risk factor. Parkinson disease results from a complex interaction between genetic and environmental factors. Around 15% of diagnosed individuals have a first-degree relative with the disease. 5 to 10% have a mutation in at least one high-risk gene. Non-genetic causes of Parkinson disease. Multiple decade studies have identified an increased likelihood of Parkinson's in association with agriculture work, pesticide exposure, and rural habitation. Chlorinated solvent used in commercial and industrial applications like dry cleaning and degreasing are associated with increased Parkinson disease risk, particularly trichloroethylene. Other chemical risk factors include manganese, suspended particle from traffic fumes, and exposure to other heavy metals such as mercury and lead. Traumatic brain injury, called TBI-SRA, implicated as risk factor for Parkinson disease. Non-genetic causes of Parkinson disease. Some medical drugs are implicated in Parkinsonism. These drugs include Parkinson is normally reversible by stopping the offending agents such as phenothiazine, butyropinones, metoclopramide, and tetrabenzene. MPTP is a drug known for causing irreversible Parkinson's that is commonly used in animal model research. Low concentration of urate in the blood also associated with an increased risk. Moreover, a possible link exists between Parkinson's disease and Helicobacter pylori infection that can prevent the absorption of some drug including levodopa. Exposure to pesticides are associated with the onset of Parkinson's disease. Lewy bodies. It is important to understand that motor symptoms of Parkinson's disease only become evident later in the course of disease, after 60 to 80% of substantia nigra neurons have already been lost or impaired. The disease occurs when 60 to 80% of the neurons in the substantia nigra already destroy or they perform impaired work. Lewy body accumulation of abnormal alpha synuclein are found in substantia nigra neuron of people with Parkinson's disease. These are brown structures, proteins which accumulate in the substantia nigra and destroy the neuron, which prepare dopamine. These neurons are destroyed and their transportation from the substantia nigra to the putamen is impaired. Dementia with Lewy body is a type of dementia characterized by changes in sleep, behavior, cognition, movement, and regulation of automatic bodily functions. Memory loss is not always an early symptom. The disease worsens over time and is usually diagnosed when cognitive impairment interfere with normal daily functions. Together with Parkinson's disease, dementia is one of the two Lewy body dementia. It is common form of dementia, but the prevalence is not known accurately, and many diagnoses. The disease was first described by Kinji Kosaka in 1976. Parkinson's disease. We can remember Parkinson by these four alphabet TRE. T is for tremor. A tremor or shaking usually begin in limb, often hand or finger. A patient may rub thumb and finger back and forth, known as a pill rolling tremor. Hand may tremble at rest. You can see that this is the pill rolling movement which occurred in Parkinson. And when a person picks something, there are tremor in his hand and they can be observed very easily. Tremor are a major symptom of Parkinson's disease, presenting in about 75% according to the trusted source. Parkinson's disease rigidity. Rigid muscle stiffness may occur in many parts of body. Cogwheel rigidity refers to a potential early sign of Parkinson's disease. It describes a type of rigidity that typically affects the limb, causing them to move in small increments similar to how gears move. Here is the cogwheel movement. You can see this occurs in Parkinson. Akinesia, slow movement of bradykinesia. Over time, Parkinson's disease may slow movement, making simple tasks difficult and time-consuming. Posture impairment, posture and balance. Posture may become stupid or imbalance problem as a result of Parkinson's disease. You can see in this video that the movements are slow and the balance is a stupid type of balance. Loss of automatic movement. Patient may have a decreased ability to perform unconscious movements, including blinking, smiling, or swinging arm during walking. Speech change. Patients speak shortly, quickly, slur, or hesitate before talking. Speech may be more of a monotonous rather than have the usual inflections. Writing change. It may become reduced to write and writing may appear small. You can see the writing style of a Parkinson patient. Parkinson, the patient write small letters and slowly, and the letters are small. So this is the summary of Parkinson's disease. The symptoms are loss of smell, drooling, occur when excessive salivation flow out of mouth involuntarily, constipation and gastrointestinal problem, sleep problems such as restless leg syndrome, mask space. There is no impression on the face of Parkinson's disease patient. Common motor related symptoms are slowed movements. The movements are slow, tremors while muscles are at rest, rigidity or stiffness, blinking less often than usual, trouble swallowing, and unstable posture or walking gait. Symptom Parkinson's disease. occur when arm or legs is held out, go away when move. With movements, these symptoms disappear. May be worse when tired, excited, or stressed. In this condition, the movements can be exaggerated. Can used to be rub finger and thumb together without meaning to call pill rolling tremor, as discussed previously. Eventually, may occur in head, lip, tongue, and feet. Other symptoms may include anxiety, stress, and tension, confusion and memory problem, dementia, depression, disturbed sleep, fainting, low blood pressure, and memory loss. Examination and test. Healthcare provider may be able to diagnose Parkinson's disease based on symptom and a physical examination. But the symptom can be hard to pin down, particularly in older adults. Symptoms are easier to recognize as the illness gets worse. Examination may show difficulty starting or finishing a movement, jerky, stiff movements, muscle loss, shaking, tremors, changing in heart rate, abnormal muscle reflex. Treatment of Parkinson's disease. There is no cure for Parkinson's disease, but treatment can help control symptoms. Prescribe medication to help control shaking and movement symptoms. At certain time during the day, the medicine may wear off and symptoms can result. If this happens, change any of the following: type of medicine, dose, interval between dose. Take medicine to help improve mood and thinking problem. Pain relief, sleep problem, drooling, botulinum toxin is often used. Parkinson medicine can cause side effects. These are confusion, seeing or hearing things that are not there, which is called hallucination, nausea, vomiting, or diarrhea, feeling lightheaded or fainting, behavior that are hard to control, such as gambling, delirium. As the disease gets worse, symptoms also become worse, with stupid posture, frozen movement, and speech problem may not respond to medicines. Parkinson's disease medications. Parkinson's disease medication, most common drugs which are used are carbidopa and levodopa to treat the tremor associated with the disease. Benzodiazepine or tranquilizer. These can include clonazepam or alprazolam, which may temporarily alleviate tremors. They may cause unwanted side effects such as sleepiness and poor concentration, and affect a person's ability to perform daily activity. They may also cause individual to become dependent on these medications. Anti-seizure medication, primidone, when beta blocker are not effective in reducing tremors. Botulinum toxin or Botox in the form of injection to treat almost all types of tremors, although they can improve them but can cause weakness of the muscle. They can improve the symptom for months, but the side effect is that it can weaken the muscle. Dopamine agonist and other type of medication for treating Parkinson disease. Beta blocker propranolol help treat tremors. Surgical cure of Parkinson disease. Surgery may be an option for some people. Surgery does not cure Parkinson disease, but it may help ease symptoms. Type of surgery include deep brain stimulation. This involves placing electric stimulator electrode to send high frequency electrical signals to the thalamus. Stem cell transplant and other procedures are being studied. There are few in MCQ. Please read the stem, pause the video, and choose the correct answer. The key is given. These are other questions. And the last one is, so for this, please pause the video and read the stem and choose the correct option. So thank you. Please subscribe the channel and write down your valuable comments in the comment box for the improvement of the channel.